course is 12 weeks in duration. I think the course you're going to is 10 weeks, and it's not a university course. But the university course is 12 weeks in duration, 4 weeks theory, that's becoming 5 weeks now, and 8 weeks clinical. Now some courses have 4 weeks clinical. 4 weeks clinical, when you're coming from India and going to Australia, is not enough. You will go to the employer with unprepared and not ready. And we get complaints from employers all the time, not about our nurses, but about other nurses that have gone there with other agents, that they don't have the clinical skills that they need. Because one of the reasons is they go to a 4-week course rather than an 8-week course. An 8-week clinical course, I should say. You won't be learning from textbooks. You'll be doing assignments. Now the reason the universities, I don't know what the other courses do with assignments, I don't know whether they do them or not. The universities do assignments simply because they're trying to get you as a nurse to think for yourself. In Australia, you as a nurse, you run things. You manage pretty much all the healthcare workers. Certainly you directly manage about 5 assistant nurses. You manage the physiotherapists and all the other professionals. You manage the doctors. The doctors don't manage you like they do in India. You manage the doctors. And most of the management positions in healthcare in Australia, both in public and private, are nurses. They run the place, basically. But they need management skills to do that, and they need to be able to think for themselves, not to be turning around to a doctor every 5 minutes. So, what do I do, doctor? So they give you research assignments to teach you to think for yourself. They expect you to think outside the square and to make decisions, but also to be assertive and confident. You have to be able to tell a doctor when you think he's wrong. Now, you've got to be diplomatic about that, obviously, and a doctor is clearly good at what he does, but doctors make mistakes, and you have to be assertive enough to quietly talk to him about that. You have to do that with all of the healthcare professionals. You have to deal with the relatives. The relatives can get quite difficult to deal with because if they put their mother and father in an aged care home, they feel guilty about it, and they'll take that guilt out on you. So you have to be able to deal with those people, and the same thing in the hospitals. The relatives exercise quite a bit of power in that they're the ones who are putting people in the institutions. So the people that we see go into the course are very different from the people we see come out of the course. And then when we see them another year later after they've been with the employer, they're different again. And different in a good way. The course, this particular course has a 100% success rate, primarily because of that progressive assessment and the fact that you've got tutors and the fact that it's a university and you're being taught the right way. I mean, when you think about it, you can't go to Australia now without a BSc. All of the education in nursing in Australia is university-based. Some of these other courses, while they're approved by the board, they're not university-based, and they do not teach you enough about how you should perform with the employer when you get there.